That's good. You know, I have a real impulse when I'm on a screen in front of a lot of people to be like, attention, Earthlings. We've taken over your planet. Resistance is futile. Um, anyway, you know, when I speak at things like this, a lot of times it's a little bit like preaching to the choir. You guys know more than I'm going to say. So I'm sorry if some of this is review for people. I'm hoping it's mostly new material. I'm adjusting the aim a little. So the title of the talk is a bit tongue-in-cheek. It's about treating post-traumatic stress disorder with illegal drugs. The idea is that there are two studies going on right now. Well, it's not accurate. I'm the medical monitor for two studies, one of which is ongoing and one of which is being planned, and we're meeting with a little bit of resistance from the government, as you might imagine. But in both cases, we're trying to use Schedule I drugs to see whether they would be helpful in treating post-traumatic stress disorder. And I imagine some of you know about the work using MDMA to treat PTSD. There was a study that's already been completed and published where we had 20 subjects with post-traumatic stress disorder from anything. It could be from rape or chronic sexual abuse in childhood. But the results of the study were really impressive. Like nothing that you would see. You know, there are certain drugs in America that are legal that have been approved by the FDA for treating post-traumatic stress disorder. Their results were nothing compared to what we saw here. Pardon me while I look down. I mean, the bottom line with this first study was that 80% of the people that we ran through the whole protocol by the end didn't meet criteria for the diagnosis anymore. They didn't have the symptoms. You couldn't call them post-traumatic stress disorder patients anymore. And you know, the word nobody wants to say is that they were cured. They didn't have the illness anymore. You don't see that in psychiatry. You usually just see sort of an amelioration of symptoms. We had 12 people given MDMA and 8 people giving placebo, and of the 12, 10 improved tremendously. And the 8, we had 2 improved, and that is sort of a testament to what great therapy they received during the protocol. But after they were unblinded and it was seen that they were placebo, those 8 people got to receive MDMA, and then 7 out of 8 got the same sort of results that 10 out of 12 had gotten before. So. Hello, not sure what happened there.
Yeah, that was a little wonky.
All right, no more alien takeover jokes.
Okay, continue, please.
They have a horrible sense of humor. So, where was I?
Placebos.
Yeah. So anyway, you know, when all was said and done, we had 80% who no longer met criteria for the illness, which was pretty impressive. So the next step was to go ahead and offer this treatment to veterans from the Iraq and Afghanistan war. We had something 1.5 million vets coming back, and about 300,000 of them seem like they've got pretty significant post-traumatic stress disorder. It's basically like 1 out of 4, 1 out of 5 people that are coming back have got really bad PTSD. So I don't know whether it makes sense to go through all the criteria of PTSD, but you know, it's basically an anxiety disorder where you've been traumatized and you're sort of on DEFCON 5. I can't see you guys anymore. I hope you can still see me.
Yeah, I turned you off so it frees up bandwidth, so you,
all right.
You don't get jerky. We'll turn it back on when we do Q&A.
But I have a lovely, no, I'm just kidding. You can't see my beautiful green shirt from India. So,
we can see you.
Okay, good. But but I wore it special. Wait, are you lying to me, Charles? I can tell when you lie. So, all right. So, post-traumatic stress disorder is basically an anxiety disorder. It's one of avoidance and hyperarousal. You've been traumatized. You avoid anything that reminds you of the trauma. You're on sort of hyper-vigilant, hyper-alert. You've got an increased startle response. You've got intrusive recollections, flashbacks, nightmares. You're just kind of a quaking, quivering mess. And people get very depressed. They get suicidal. Actually, one horrible statistic that keeps getting thrown around, 1,000 veterans are trying to commit suicide every month. Attempted suicides, 1,000 a month. Completed suicides, 4 or 5 every day. So, here we're really talking about a fatal illness. These guys are in really bad shape. So the next study that's currently underway is taking 16 service-related post-traumatic stress disorder patients, trying to do 8 men, 8 women, and so far we've been running both genders, and giving them MDMA, which we can talk a little more about, in the context of ongoing psychotherapy to see whether we can help treat their post-traumatic stress disorder. And these are people who have been treated with therapy, treated with medicine, it's not helping, get treatment-resistant PTSD because that's what the FDA was more comfortable allowing. I'm sort of assuming that you guys understand MDMA and how it might work in therapy, but I don't know if that's an assumption I shouldn't be making. I mean, MDMA is better known as ecstasy. It is a massive serotonin agonist. It floods the brain with serotonin more than it's really ever seen. And to simplify things, the easiest way to think about serotonin is it helps you to feel happy and relaxed. You're less anxious. You feel like you don't necessarily need anything. Like whatever you need, you have. There's this feeling of satiety. I have what I need. There's a lot less angst. And there's a lot less fear. It really sort of, it paralyzes the paralytic fear. It stops it. So, and that seems to have to do with the left amygdala for people who are interested in neurophysiology, neuroanatomy. If you look at PET scans and things like that, the blood flows way down in the left amygdala, which is sort of the fear center. So because there's a lot less fear, you can sort of get to the places you need to go to in psychotherapy. The thing about psychotherapy is it's very slow and you're sort of peeling back the layers and getting to the places where you've been hurt. And MDMA sort of, I think of it as almost like anesthesia, where the same way if somebody needs surgery, it's hard to sort of get to that malignant tumor if they're awake and fighting you. If you knock them out, you can just get in there and get it out. And with MDMA-assisted psychotherapy, it's a little bit like having an anesthetized patient where they're much less resistant to going to places where they really need to go to get to that malignant thing and examine it and pull it out and get rid of it. So it's a catalyst to psychotherapy. It helps the therapy go deeper, faster, more efficient, and it allows people to go to places where they really can't get to without it because they've got a lot of fear. But when you've gone through something horrible, you sort of need to debrief and talk about the horrible thing. But when you have post-traumatic stress disorder, you just can't get there. You're very walled off from it, and this allows people to be opened up. So the research, the way the protocol is set up, there's a lot of psychotherapy. There's like 3 sessions before they're given the MDMA, and then there's 3 sessions after they're given the MDMA, and then there's another MDMA session. And there's like a total of, I think, 16 psychotherapy sessions throughout the protocol. Which is why even the placebo group does improve. The people who are doing this therapy are a husband and wife team down in South Carolina, Michael Midhofer and his wife Annie. And Michael is a doctor and Annie is a nurse. And they're really doing good work, and it's tough. It's really painstaking. Running each person through the protocol probably takes a good 3 months. And I have a book out on ecstasy called Ecstasy, the Complete Guide, and all the proceeds from that book are helping to fund the research. But if anybody feels like helping to donate money toward the research, I think the easiest thing to do is to go to maps.org, maps.org, where there's opportunities to donate. I think on my website, if you go to drholland.com, there's probably a way to donate as well. But anyway, I don't mean this to be a plug for money, but this is not the kind of research that the American government is funding, and certainly not the kind of research that Big Pharma is funding, because you're talking about a pill that somebody would take 2 or 3 times in their lifetime, and that's the end of it. And, where's the money in that? And also, this is not something that can be patented because it's already been patented. So this is it's not about a money-making venture for anybody. So this is really, it has to come from private sector, this kind of research. So the other illegal drug that we're trying with post-traumatic stress disorder is cannabis. Pot in America is Schedule 1. It's in the same schedule as heroin, LSD, and MDMA, psilocybin. There's all kinds of therapeutic drugs in our country that aren't considered therapeutic. So, Schedule 1 means that there's no accepted medicinal value at all, and that it's addictive. So of course, you could see cigarettes and alcohol would be in Schedule 1. But instead we have these therapeutic, somewhat less toxic drugs that are inappropriately scheduled. So we're kind of going back and forth with the government a bit in trying to get this next study off the ground, and that is in veterans with post-traumatic stress disorder cannabis to help with their symptoms. One of the things that cannabis is great at is stopping nightmares. And depending on what you smoke, you can get more anxious or less anxious. But a lot of people, it's sort of easier for them to get in touch with themselves and what they're going through. So what we asked the government for was a bunch of different strains so we could look at THC and CBD and get an idea of what does what. Now CBD, a lot of people don't know about. I didn't know about it until I started editing a book on cannabis a while ago. I edited this book called The Pot Book, A Complete Guide to Cannabis. And again, proceeds from this book fund clinical research. So this is sort of a nonprofit venture. But what I learned, spending 3 years learning about cannabis, was that there's a chemical in pot called CBD, cannabidiol, which is particularly good at decreasing anxiety. So what we're looking at with this PTSD study is getting high CBD pot to veterans and seeing whether that helps them. This isn't necessarily something that the government has access to at their farm or that they want to part with. And there's been a lot of politics. I don't know if anybody's really following what's going on in America, but we have a complete monopoly on cannabis where NIDA, the National Institute on Drug Abuse, which is a government group looking, their mission is to look at the dangers of drugs, basically. They're not interested in seeing whether things are beneficial or therapeutic. So when you petition the FDA that you want to study a medicine, usually they just say yes or no. But if it's pot, then NIDA gets to weigh in. And NIDA doesn't say yes or no, they just say, oh, we lost your application, or we'll get back to you. And there's crazy delays. FDA will give you an answer in 30 days. NIDA doesn't have any requirements on when they get back to you. And so you'll just go months and months and not hear from them. You'll go a year without hearing from them. And then when you finally hear from them, they'll tell you that, they can't find your application, you have to start over. They're really playing games. So we're going back and forth with them to try to get permission to do this PTSD study, but the biggest issue really is the supply of the research drug. There's only one game in town in America. It's a farm in Mississippi that the government runs. And as you can imagine, the quality of the research material that the government is creating isn't that great, isn't necessarily what we want. And we've been petitioning the government to let us grow at a separate farm to break the monopoly, and the petition was just delayed, but they just denied it. So MAPS is really sort of spearheading this fight to get the government to allow somebody else to grow research-grade cannabis. And they're not taking no for an answer, but it takes a lot of time and a lot of money and a lot of lawyers to fight the government on this. But we're going ahead, and I believe that MAPS has gotten some pro bono legal counsel recently that's going to be very helpful for us. So those are the two studies with post-traumatic stress disorder and illegal drugs. One is MDMA, one is cannabis. I can tell you more about MDMA if you'd like, but I think, I'd really like to open it up to questions because that's what I love. I love answering questions, and I'm sure you guys are going to have things that I didn't think to talk about with you. So if we can open up to Q&A, I would like that.